So this tape job is for elbow hyperextension. So we're trying to prevent the elbow from moving too far into extension. As with our other tape jobs, we want to be sure that the patient doesn't have any allergies to the tape we're going to use. May want to add a little spray, although I don't in this video. You could add that in there. And then we want to be sure that they've been evaluated by an athletic trainer. Want to be sure that we're checking for any open wounds. Make sure we cover those. Check the range of motion that we're going to get. Again, we want to make sure they have plenty of function, but not too far into hyperextension. We're going to have the patient flex their biceps so we don't cut off circulation there. Make sure the muscle is flexed as we go around, and put 2 anchors at the proximal end. Make sure you angle those upward to help prevent the gapping, and then 2 anchors at the distal end around the forearm. Try not to make those too tight down there either. So we're then going to move on and use the elasticon tape, that heavy elastic tape. We're going to make check reins here. We're going to make an X pattern across the fold of the elbow, just helping to keep the elbow from moving too far into extension. One straight down the middle, and then a third that will go in the opposite direction. If you feel like these are pulling off at either end, you can split the tape and wrap around the limb. That's more helpful. If you tuck in the ends at the middle part of the elbow, helps to prevent any excess tape right at the fold of the elbow. Then I'm going to place 2 more anchors around the tape that we just placed on there. Just cover up those ends so they don't pull off. And finally we'll close off with some power flex. Nice and loose around. I'm going to leave the section of the fold of the elbow open to allow them to function properly. Push down the end there, and then check to make sure they can still get through the normal amount of extension without hyperextension. And then be sure we have them perform whatever functional activity they're getting ready to do, to be sure that the tape is appropriately applied.